3:21 on Maryland's News Now. I'm John Patty, and as we learn more about those aboard the Malaysian airliner that crashed in Ukraine yesterday, we know that at least one American has been identified as a passenger. The president identified Quinn Lucas Shanson. There were also two leading AIDS researchers on board, Joep Lang and his wife, Jacqueline Van Tungeren. Joining us to reflect on their work is Dr. Robert Gallo, director of the Institute of Human Virology at the University of Maryland School of Medicine. Dr. Gallo, given your groundbreaking work in the research of the AIDS virus, how much of a loss is this?
It's impossible for me to quantitate the magnitude of the loss. But I'll come to that in a second. First, I think it's important that we recognize that there were, one-third were AIDS researchers. Two-thirds are other people, and they're equally important, and some may be doing things that are even more important than all of us are doing. Who knows? So we can't forget the rest while we focus on the irony of people who have devoted their careers to helping people, particularly in developing nations, that they are killed by lunatics in a developing nation where there's a significant AIDS epidemic. So without a doubt, though, when you lose, I only know what I've been, told. If it's 100 people, including our colleagues and friends that are definitely, those two were leaders, then you can't really measure the loss. I would say that if they were going to the International AIDS Society meeting, it's not likely to be the basic scientists. They're usually not attending that meeting for the majority anyway, vast majority. It's more likely the people in the front lines like behavioral research, epidemiology, and clinical care, and using the drugs properly, and teachers. So in a practical way, it could have a very serious impact, particularly in the developing world. Now, Joep Lang was a leader. I mean, he's somebody I did know and know a long time. He was a great guy for epidemiological and behavioral studies, while at the same time having great understanding of the science of HIV and AIDS. In fact, he was a host for myself and my wife and Professor Justin MacArthur at Johns Hopkins when we were visiting professors there together about 15 years ago. He's also, a guy great to have discussions with related to HIV and AIDS and other things as well. So surely a very missed person. Now there could be other people on that flight that I know and can't comment on because I don't have the names. And suffice it to say, we don't need to make it more dramatic or melodramatic than the obvious. People, that's it. People are lost.
How much of their work was done with you and your staff there at the University of Maryland School of Medicine?
Well, I can't say anybody on that. I don't know who's on the flight, so I can't answer your question. I'm sorry. It's a poor answer, but I really don't know. But the Dutch group that he trained, a number of them had been interactive and collaborated over the course of years. In fact, every time they have a doctorate thesis in Holland with this group, they would always send out the PhD written thesis of the young man or young woman so that you could read and give impressions and write back to them. So we had that kind of contact and sometimes collaboration. He trained a lot of good young guys and gals, particularly from Holland, of course, where they were from Amsterdam. So, but I don't know the other people because I don't know who was killed.
Sure, that's because they were traveling to the AIDS conference, and there were others on the plane who probably were traveling there as well.
I strongly suspect that is the case, and we don't know their names yet, so sure. It's hard to comment.
What about the contribution Dr. Lang made early on?
Well, I think Lang's contributions were important in the epidemiology, in the behavioral area, and even on the approaches to drug therapy. He's one of the earliest persons in Europe, particularly, to get deeply involved, and he helped train a cadre of people from Holland that have become really, I'd have to say, per capita, the Dutch have been among the most, if not the most, prominent people in the world. I don't mean as much as the PEPFAR program in the United States from the beginning with W. Bush and continuing with Obama in helping Africa in a financial way, but they've really been involved deeply in AIDS with a lot of good science right from the beginning for a relatively small country. Very impressive. And he was, if you had to pick one name, he would be at the top of the list in Holland.
Had Dr. Lang ever traveled here to Baltimore to do any work with you at the university?
he never directly did work here at the university, but he's been here to get part of our international meeting that we have yearly. But no, not as a. Well, I hesitate. Not with me personally. It's possible with my colleague Dr. Blattner, epidemiology, or Dr. Redfield, head of our clinical division. So, but that would likely be indirectly with people he trained.
All right, Dr. Robert Gallo, Director of the Institute of Human Virology at the University of Maryland School of Medicine. Thank you for your thoughts today on Maryland's News Now.